places, you can call 999 emergency or go to A&E. However, in the UK, you also have the option of calling 111 or going to an urgent treatment centre. And then also, in terms of other medical problems, in China and Hong Kong, you can go to either independent private clinics or you can visit as an outpatient at the clinic and at hospital, whereas in the UK, we obviously just have our GP surgeries. And then also there are also more differences between the two countries' health systems. So, for example, again, in China and Hong Kong, some clinics are open 24/7, whereas here in the UK, our GPs are closed at night and also during public holidays. In China and Hong Kong as well, you can have an appointment and see the doctor either through booking appointment or going and walking in, whereas in the UK, you can only see a doctor if you have booked an appointment in advance. And then finally, as well, in the UK, we also offer things like e-consult, and then we also, in terms of appointments, we don't just have like in-person appointments, there's also the option of having telephone appointments, video appointments nowadays, whereas in China and Hong Kong, they don't have anything like e-consult, and it's much more, they only really have in-person appointments. Telephone appointments, video appointments aren't really common there, so they may be a bit more confused if you give that to them in the UK. And then just at the very bottom there, again, in Hong Kong and China, it is being able to use Chinese medical services or herbal medicine is much more common over there. Here in the UK, it's a bit more difficult to find that. And then I'm just going to pass over to my colleague, Chloe, and because she may have a bit more to share with you about some of the barriers that some of the new migrants are facing in terms of healthcare as well.
Yes, good morning, everyone. I'm Chloe, the Health and Wellbeing Manager of CCWS. It's just like myself, I'm a Hong Kong new immigrant, just come to the UK for like 2 years. And I think this healthcare system is really different, and there's quite lack of information that we can know how is it run and how do we adapt to it. It's like I think most recently, I just know that we can get help from the pharmacist for like if I feel I'm ill, I should go to the pharmacist. It's quite new idea for us, I think, for the Hong Kong people especially. And sometimes when we see when we have a consultation with the doctor in the phone, maybe, and they don't prescribe medication, that is quite a new thing for us too, because maybe they just ask you to go to the pharmacist, or they should just say, oh, maybe you can just continue your own medication. It's like in Hong Kong, even like paracetamol, the doctor will prescribe it, and it's quite easy. In Hong Kong, we just walk into a private doctor is a really common thing. So I think they have to like manage their expectation, but also if there is way for us to like how can we know more about how does the system work, that would be good for us. Yeah, just want to share a bit about this.
Okay, thank you, Chloe, for sharing that with us. Okay, so now I'm just going to move on to talking about some of the more general barriers that the Chinese community will face when trying to access healthcare. Okay, so the first point is lack of understanding and knowledge. And so really this can kind of be split into two parts. So firstly, many may not have knowledge or awareness about certain health conditions. So for example, mental health or dementia. So just using the example of dementia, so many Chinese people, they have misconceptions on what dementia is in general. So many do not know the different types of dementia, what the symptoms are apart from memory loss. And so for the Chinese community, because they do not recognize many symptoms of medical conditions, they do not bother seeking a diagnosis. For that one, I don't think it's just limited to Chinese people. I think people sometimes in general, they don't know certain symptoms of certain medical conditions as well. But also, in addition to this, the Chinese community, as Chloe mentioned, they know very little about sometimes the process um, or kind of the assessment procedures in terms of for health conditions as well. Um, like Chloe said as well, they don't really know the steps of how you may go about seeking help or seeking a formal diagnosis. Also, a lot of them underestimate the importance of receiving a formal diagnosis because many of them don't realize that if you do sometimes receive a formal diagnosis, that you can receive additional support or medication, which may be able to help manage their condition. Okay, and so the second point, the second barrier that I really want to talk about is quite an obvious one, which is language and interpreting. So for some in the Chinese community, and this may be more so for older Chinese community members or those who migrated here before the 21st century, many of them are not that confident in English sometimes. And in some cases, they do not speak any English at all or just very, very little. And so because of this, they really struggle to communicate during appointments or may even struggle to book an appointment, which if you think about it, that's the kind of the very first stage when trying to sometimes access healthcare. So also in terms of interpreting, although it can be provided, the standard of interpreting can sometimes be inconsistent. So again, for example, if you had, let's say, a patient from Hong Kong who speaks Cantonese as well, so they may have a Cantonese interpreter booked, but that interpreter, they may speak Cantonese, but Malaysian Cantonese, which can be very different to Hong Kong Cantonese. And so while the patient, they are very grateful for the support and it is better than nothing, the interpreting may not always be accurate. And so important information may be missed out, or in the worst case scenario, the patient may not really be able to understand anything that is being said. Another kind of barrier is that because it's kind of the hassle of booking an interpreter sometimes, because if you need an interpreter, I think sometimes you need to book like a double appointment. And so for some Chinese community members, they may think this is too much trouble, and so just don't book an appointment at all. Okay, and then now I will just talk about the third point on there, which is stigma of certain medical conditions. So because there is some stigma surrounding certain health conditions, as you can imagine, that often means that they are not talked about or discussed within the community. So just again, an example using mental health. Many Chinese community members, they may feel anxious or depressed, but as it is not something that but it is not something they think they need to seek help for or want to admit to having. And again, this is similar with dementia. There is a stigma surrounding this condition. As in Chinese, the term for dementia is directly translated to meaning old person gone crazy. So as you can probably imagine, many people do not want to associate with it. Also, because of the term old person gone crazy, many people view people living with dementia as violent as well, which is unfortunate. So when wanting to discuss more sensitive topics, maybe such as mental health or, like I said, dementia with the Chinese community, we do try to tend to phrase things differently. So using mental health, we would either use the term mental well-being instead, or if we want to promote things to do with mental health, we will tend to use terms or phrases like how to look after yourself instead, things like that. Similarly, with dementia, instead of using the term, which translates to old person gone crazy, we do use a different translation, which means brain degeneration instead. So this does help trying to make these kind of topics of these health conditions much more accessible to the community as well. And then moving on, sorry, to the fourth point there on the screen, which is cultural barriers and losing face. So yeah, another barrier is the cultural barrier. So this is really in terms of that our community, so the Chinese community, is very much known as being an invisible community. And this is really just because we don't like to speak up, or we don't really like to make a fuss or cause any hassle. And so because of this, it makes it really difficult for GPs or local health providers to know when Chinese people may be struggling. So another example of this really is if you may be seeing a Chinese patient and they may be nodding along to what you're saying, but actually they may be actually very confused inside and not understand what you're saying at all. However, they won't say anything. And so you probably think, oh, okay, they're fine. But then they may leave the appointment later, remembering and understanding very little of what has been said to them. So we did raise this issue with GPs before, and we did have a suggestion from them in that they said it may be good that if you are making notes during the appointment, that if you can maybe print them off and give a copy of that to the patient so that they can then take that away with them and then get someone to help read it out to them. And so then they'll be able to understand more what was being said during the appointment. So that is something that could be quite useful in helping them. And then I'm just going to move on to the final point on here, which is anxiety. I don't necessarily think this is just limited to the Chinese community or Chinese culture, because I think often some other people may be sometimes a bit anxious when going to an appointment, but this is another barrier that many Chinese community face. And they may delay going to see a GP because they're anxious about what the outcome may be. So again, for example, just using another example, sorry. So for Chinese students, some may be worried about their mental health, for example. However, they may delay or avoid going to seek help for this because they may be worried what will happen if things that are said during the appointment will be shared with people such as their parents or their teachers, which will then, for example, maybe impact on their studies. And so on. And then also many people also fear what may happen when they have been diagnosed with something. So how will their life change and so on. So a lot of people I find in the Chinese community, they just avoid going to the GPs as a result of this anxiety. Okay, so I've just mentioned some of the main barriers that our Chinese community face, and now we're just going to start moving on to introduce to you some of our services that we have here at our organisation. So I will now pass on to my colleague Joe, who is the manager of the Chinese Lantern Project, and he will share more about what the service is about.
Hello, good morning, everybody. Thanks, Emily. My name's Joe Hai, so I'm the Chinese Lantern Project Manager, which is based around a helpline service. Emily, could I keep on to the next slide? So the service, it's a free helpline which covers the southwest, so anywhere from the BNSSG area down to Devon and Cornwall. Our helpline team provide information and support to the community, the Chinese community, and they speak English, Cantonese and Mandarin. We are involved in the Student Wellbeing Project. As Emily just mentioned, there are issues regarding student mental health and wellbeing. And because we cover the Southwest, we work very closely with people like University of West of England and University of Exeter. In fact, University of Exeter have actually incorporated our helpline service into their student support information, albeit as an external provider. As part of our work, we work with local organisations to provide information and workshops. Just as an example of some of the work we have done over the last few years, we have worked with BrizDoc in providing NHS 111 and GP out of hours information service to explain to obviously the community exactly why they should use NHS 111 rather than 999, and obviously what happens when they contact the GP service and there's no one there, obviously during the evening. We also work with people like Health Watch Bristol. So we've done Health Click workshops. We did 2 of them for our community to learn to use the NHS app and also NHS website. We were supposed to be doing more, but unfortunately, Healthwatch Bristol didn't get further funding post-March this year. So we do not have any more of those workshops. We're also part of the mass vaccination program as well with BNSSG. So the Reducing Inequalities program that they were running, we were part of that, and we organised vaccination days for our community. When I say our community, it basically covers East and Southeast Asian, so anybody who's Chinese speaking. So although, you know, the main languages are Cantonese and Mandarin, it does cover some of the community sort of further down into Southeast Asia as well, such as Malaysia, Vietnam. Some of these are obviously Chinese speakers. So we're part of that Reducing Inequalities program as well. We have done, I say we continue to provide workshops for the community. We also work with people like Diabetes UK, and we've done workshops with Parkinson's UK. As Emily mentioned, some of these topics can be quite daunting for our community. If some of them are quite taboo as well. But what our aim is obviously to provide information to the community so they understand there are services out there who can obviously help and assist. And something like Parkinson's, similar to sort of obviously dementia, is not something our community want to sort of hear about or talk about. So it is quite difficult sometimes to get them to understand some of these obviously conditions that may affect them in the future. Emily?
Yeah. So thank you. So I've just left the contact for the telephone number, that is the number for the helpline, also email, but I have put all of the contact details at the end of this presentation as well. Okay, so now I will pass over to my colleague Ming, who is the manager of the Care Support Service.
Thank you, Emily. Good morning, everyone. My name is Ming. I'm the Care Support Service Manager. Our team offers support to two groups of people, and they're older people and unpaid carer. So for the older people, we're talking about those 55 plus, and we have a team of fully trained care support worker who can provide language and culturally appropriate service to the elderly. We help them to stay in their own home and remain independent. Our services include sitting service. So our care support workers will go to the client's house and offer companionship, listen to them, talk to them, and help them to reduce loneliness. And also we can help with practical housework, like tidying up the house, cleaning, light gardening, and prepare meals. I don't know if you know that Chinese, we have very particular meal preference, because we don't really like cold meal. We always want hot meal, like noodles with soup or rice or other dishes. We like hot things, not like cold things like sandwiches. So this will be better for the elderly if they can have something they like to eat. Otherwise, they'll be like starving themselves. So apart from this, we also offer support plus service, such as helping with shopping, visiting friends, and attending appointments and events. So they can go out and enjoy the life, not just staying at home. That will reduce loneliness and also the isolation as well. Next slide, please. For carers, I'm not too sure if you know, in Chinese society, we don't have the term carers. So because we think that taking care of our family and friends is our responsibility, which is very different in the UK. So our work is to raise awareness of the role carer in Chinese society. We let them know what the rights are and what support they can get as well. We have a group of people that they join carer support group, which we offer regular information and well-being workshops for them. For example, last year we have 10 workshops and we had over 150 participants, and we have art therapy, information of dementia, energy saving tips, and like rubber band fitness, etc. And these workshops help carers to improve their physical and mental health. Also to provide opportunity for them to get connection with other carers, to share their experience and to discuss their difficulties so they don't feel that they're alone. We also help the carers to do carers assessment. Most of the carer, they don't know they are entitled to the assessment. So we support them with form filling, to communicate with the council, and also to get positive outcome of the assessments. And apart from that, we also help the carers to assess other services. For them, it will be difficult to know what's available due to the language barriers. So we help to promote other organizations' services, activities, and events, so the carers will be able to participate. Next slide, please. Now I'm going to share a case study. Mr. C is a carer for his own son who had brain damage and is living in a care home. He approached us and wanted to get financial support for his son. Our team helped to communicate with DWP to apply for PIP for his son. And we also helped Mr. C to do carers assessment so he can get some extra money to reduce his sorry, to reduce his stress and also to enjoy a bit his own time apart from taking care of his son. And after that, Mr. C joined our care support group to receive continuous support from our team. And this is the end of my presentation, and I hope you understand a bit more our service. Thank you.
Okay, thank you. Thank you, Ming. And then again, here is the contact for the carer support service. And now I will hand over to Chloe, who is our health and wellbeing manager, to let her talk a bit about her project, which is the anticipatory care service.
Thank you, Emily. Can you all hear me?
Yeah.
Yeah, because there's some problem with the screen. Okay, so the anticipatory care service is it might be called a proactive care service now. It's funded by the NHS ICB Winter Project. So can we go to the next slide, please? Yeah. So we are mainly supporting discharged patients in their recovery. So we aim at like understanding the needs of the Chinese community and plan for their discharge together with them. Like normally, they just don't understand all the discharge plan and they just accept everything that they are brought to. But sometimes they can't talk about what they want, and so actually they are unhappy, but they don't speak up. Yeah, so we kind of making sure that their voice is heard and their needs are being well supported. And we also like increasing the availability of other resources. Like it's so nice to have this presentation with the care coordinator and social prescriber. Yeah, so we can collaborate and like we can advocate for them. The main purpose of this project is to like avoid the prolonged hospital stay. Like sometimes they don't want to leave the hospital is because they think they can't live independently at their home after discharge because they know they don't know where to get the support and they think they can't handle the situation, so they prefer staying in the hospital. And also we would like to lower the risk of readmission by providing our services. So please go to the next slide, and that's our service. So it's to advocate on behalf of the patients, because like our staff, we can speak mostly both English and Cantonese or Mandarin, so we can communicate with our clients better. And you don't even need an interpreter if this project is like provide to the patient. And then most of our members, we have a good relationship with them. Over the years, we build trust with them. So sometimes we already know about their situation. We don't have to ask too much information. And one thing that you have to know is the Chinese community, they really, everything is built on trust. Yeah, if they meet you in the first time, they don't really want to talk about anything. It takes time to build a trust. So for our organization, it's been like 30 years, and we have been building our relationship with them. So it's very good for us to advocate for them. And then also, we are now under the progress of registering for the CQC. So we are aiming at providing personal home care. Yeah, but it's still in progress. But in the meanwhile, like Ming said, we have the care support service, so we can provide sitting services and also like domestic care, which also helps a lot. And during the process, we hope to monitor the client's physical and mental well-being. If there's any problem, we can prompt for like following up, helping them to signpost to different departments, and like regular reviewing their needs, and then yeah, so that we can provide different services and signpost them. Yeah, and also we as they have mentioned already, like we have lots of training and support to carers, like we have workshops like for prevention, which is very important to reduce the risk of readmission. Yeah, and then the next slide, please. Yeah, so there is also a case study for my project, like this Mrs. Zheng. She's like 85 years old and working with 8. And then in February 2023, she fall at home and admitted to the hospital for 18 days. Then after 1 week of discharge, she admitted again. It's kind of curious. It's like maybe dehydration. I think she didn't take good care of herself. So after this project is funded, so we collaborate with them, see what we can help them for this discharge, and then we speak to the Sirona discharge team. So prior to their team visits, me and Ming, we went to Mrs. Zhang's house and talk about what's her needs and what's her ability. So in the time, we also act as an interpreter also to collaborate with Sirona, so we can know more about what Mrs. Zheng really wants for her discharge care. It's like Sirona is providing like some sandwiches and like waking up early in the morning for Mrs. Zheng to take a shower, which is in our culture is really difficult. So yeah, and alongside we provide our sitting and domestic care service and like heating up meals that prepared by her daughter, and so we can yeah, go to the next slide, please. Yeah, so that's the we interpret with clients' hearts and express their needs, and excuse me. So in the gap of service, there's the language, the food, timing, safety, because there is door lock, but if the like a local English carer come to her home and Mrs. Zheng, she might not want to open the door, something like that. Sorry, excuse me. Sorry. So yeah, we have also feedback forms for evaluation, and yeah, we can see in the next slide, Mrs. Zheng, we have a consent from her that we can show her photos. She's very happy with our service, and she can have what she likes and live independently at home. Yeah, that's all of my presentation. Thank you.
Okay, thank you, Chloe. And again, that's the contact for Chloe's project, the anticipatory care project there. Okay, so now finally, I will just talk a bit about another service and another project we have, which is the Dementia Support Hub for the East and Southeast Asian community. So as part of our Dementia Support Hub, we do offer a variety of different services and activities. So before I get started on that, I will say, so this Dementia Support Hub is open to anyone from the East and Southeast Asian community. So those in the wider community who may be interested in dementia, who may be worried that they're showing early signs of dementia, then we also can help those living with dementia as well as their carers and family members as well. So, like I said, firstly, in terms of the different services and activities we offer under this Dementia Support Hub, the first one is information, advice and support, and we offer this in numerous ways. So the first one is we provide one-to-one support. Just so, for example, one of my colleagues, I'm not sure if she's here today, Kelly, so she keeps in contact and up to date with several families who have someone living with dementia, and we do provide them with ongoing long-term support, one-to-one, all culturally sensitive. We also have a dementia information library. So what's important about this library is that all of, again, the resources here, so all the books, all the games that we have, they're all, again, culturally appropriate. So they are all in traditional Chinese or simplified Chinese. And we worked with several other organizations in China, Hong Kong, and Taiwan, really, to get these resources across to our library. Apart from that, we also offer a variety of different information workshops. So again, this starts from at the very beginning. So we have workshops on prevention, so risk factors for dementia. We also have dementia awareness raising workshops. So what is dementia? What are the signs? What is the process in seeking a diagnosis, a formal diagnosis for dementia? And then we also have information workshops, which are more to help with the carers or the people living with dementia, such as just on Monday, we had a workshop on incontinence. We have workshops on how to manage your stress, how dementia medication and how to take it properly, and so on. So apart from that information, advice and support, we also hold a lot of wellbeing activities as well. And this is for the people living with dementia and their carers. So just some examples of some of the workshops we held. My colleague Kelly, we've recently done a series of gentle exercise sessions and workshops. So that included things like Qigong, which is what they really, really enjoy, again, with a Cantonese tutor. And we had gentle walking sessions. We recently did some pelvic floor exercises. We've had dancing, making lip balms, laughing yoga, aromatherapy. So a whole wide range of things for them to enjoy, because we don't want them to be just isolated. We want to keep them connected within the community and also keep them, just active. So something which is, I think I mentioned already, but which is really important about all of the services that we provide is that, again, they are culturally sensitive. So a majority, if not all of the workshops we have delivered have been delivered by a tutor who is usually from an East or Southeast Asian background and who can speak the native language of the audience and of the participants. And we found that this is really, really helpful, that when for example, a workshop or a session is being delivered by, for example, a Chinese tutor who speaks Cantonese, the audience are so much more engaged with the topic and they find it a lot more enjoyable. So another thing we offer as part of this Dementia Support Hub is training opportunities. So this is mostly for the carers of people living with dementia. So there are usually training opportunities available out there, but again, they're not really entirely accessible for people who's can't really speak English very well or who are not really confident in English, because a lot of the courses or sessions are, of course, delivered in English. So we've been working with local dementia organisations as well to create some more tailored, culturally appropriate training sessions for our dementia carers. And this offers them more practical support, such as how to communicate better with your person living with dementia. And it also helps them to understand maybe why their loved one with dementia, why they behave the way they do. So it helps create empathy as well and helps to improve the relationship between the person living with dementia and their carer. So another important part of our Dementia Support Hub is the carer support groups that we run. So again, carer support groups, there are many available across the UK, but again, there's not many which the Chinese community may feel comfortable going to, because again, they're usually English speaking, so there is that language barrier, but also the cultural barrier, because sometimes they often want to speak to someone who they think will maybe perhaps understand them better as well. So we do have a series of carer support groups. Again, this is really important in terms of building up peer support and also for sometimes offering the carers some much needed respite. We found these have been really successful since we started doing them. The group have created a really good bond, and sometimes it's really nice for them just to communicate with people who understand what they're going through, and it just takes a lot of the burden sometimes off them. They can relax as well. And then finally, something that we have also been doing and trialing within our community is these early dementia screenings. So getting a formal diagnosis for dementia is something that has been a really big problem within the Chinese community, just because, like I said, those problems of going to the GP, the language and cultural barrier, and all of that. And also because a lot of the time, the Chinese community, when they go to the GP, they can't really express the symptoms they're feeling well. So a lot of that gets literally lost in translation. And that leads to the process of getting a formal diagnosis for dementia as being very, very lengthy. And for some of our community members, it's taken up to 10 years. So because of this problem with dementia diagnosis, we received this early dementia symptom checker form from Alzheimer's Society, and we translated that into the languages such as traditional Chinese, simplified Chinese. And so we offer any of our community members who may be worried they're experiencing these symptoms to come to our community centre, which they're familiar with, which they know, and then with our members of staff who they trust and who speaks the same language as them, will help go through this early dementia symptom checker form with them. And again, what's really great about this as well is it's with someone they trust, and they can take as long as they need filling out the form. Whereas I know in an appointment, you may, obviously there's a time constraint, whereas here they can take half an hour, 45 minutes to really understand what they need to write down. And then they can take this form that we've helped them fill out to the GP, and then the GP can therefore really much better understand maybe what the patient is experiencing in terms of symptoms. So yes, that's something we've been doing trials of recently, and it's been really successful. We have managed to get a lady whose mother was experiencing dementia symptoms and just was really struggling to go to her GP. My colleague, they helped fill out the form. Then they helped also be a kind of third party in between the patient or client and the GP. And they've managed to get all of their blood tests, their scans done. And so it's just kind of speeding up and simplifying that process, which a lot of people from our community struggle with. So yes, this is Dementia Support Hub. It really is one of the main things is really help provide a lot of post-diagnostic support to Chinese people living with dementia. And then if I just show you quickly, these are just some of the some pictures from some of the workshops that we've done with our carers and the people living with dementia. And then here is the contact for our hub. And then, yes, thank you all for listening. Any questions? I realize we finished slightly early. That might be my fault for speaking too fast. But yes, any questions? I'm not sure if there's anything.
Can I just ask,
Yes.
are there any charges for any of the services that you provide, the care support service, like domestic help and things like that?
Yes, so the care support service, as Ming is still there. If Ming, do you
Yeah,
want to
unfortunately,
answer?
because we don't have any funding to provide free services, so at the moment we still charge for the services. And our session will be like minimum 2 hours per session. So try to make the best of the session. So the minimum hours will be 2 hours. And we can, based on the client's need, to visit them as often as they need, or just one session per week. So it's all tailor-made services. I hope I answered your question.
Yes, thank you.
Thank
Freddie,
you.
do you want? I can see you put something in the chat. Do you want to ask your question? Okay. Well, shall I read it out?
I think
Oh,
Chloe's got her hand up. Sorry, that's just why I hesitated.
Okay, Chloe.
Just want to add that for the anticipatory care service, for this year we are not charging it. We are providing a short-term care. It's like 1 month. So it depends on the client's need to see how many days she wants our workers to go there. So just for the anticipatory care, a short-term one, we're not charging, but you're always welcome to ask for more information. And I see in the charge that there's a question, is it about the discharge? So it said, I work in self-made hospital supporting discharge and reducing risk of readmission. I was wondering if there are any particular parts of BNSSG where the Chinese community is more prevalent. My area is South Gloss, but I work alongside colleagues from Bristol and sometimes North Somerset. I would be keen to pass on the details of your service to those colleagues that would find it most useful. So in this project, we are covering I think only Bristol and South Gloucestershire at the moment. Yeah, but it would be great if the participants is happy. We might be able to apply for more funding in the future. Hope that answers your question. You're always welcome to come to me and ask for more information. We have our email contact on the slides. Yeah, thank you.
Yeah, sorry, yeah. There is everyone's contact details here, but I'm sure Vicky will share the slides with everyone, and so you can.
Yeah, if you just put Freddie, do you want to put your email address in the chat, and then I can email you the slides?
That'd be great. Thank you.
And then we've got another one. Kathy, do you want to ask your question?
Yeah, hi. I was just wondering, I work at University of Bristol Student Health Service, and I was just wondering, you mentioned that you'd done some work with Exeter Uni, and I was just wondering what that was and what sort of support or work is useful to do with the universities, please.
Emily, do you want me to answer that one?
Yeah, maybe you want to answer that one, Joe.
Okay. Thanks, Kathy. Yeah, we basically what we've been doing, we've been working with Exeter University for a few years now, 3 or 4 years at least, and that includes both the Exeter campus and the Cornwall campus. But the reason for us working with the student support services is, again, similar to much of the information that we've given here. International students, and particularly international students from East and Southeast Asia, mainly a lot of them are mainly from China and Hong Kong. Many of them obviously have come over here to obviously study, and they are affected by things like culture change, language change, climate change. It's very difficult for them. So what we do, we work with the support services to provide our helpline service as an alternative. One of the things we find, which is very useful for particularly Exeter University and also University West of England, is if the students are struggling, they may not talk to their peers, as Emily mentioned earlier, the staff, and other people obviously within sort of the organisation, because they'll be worried about whether information is going back to their parents in particular. And obviously there's things that we talked about, sort of the cultural problems, the language problems, and things like even losing face. Obviously you can imagine students have been paid for to come here to the UK to study. Obviously their parents have paid thousands of pounds for them to travel over here. So for them, there's the extra sort of pressure of them having to making sure they achieve obviously in this country. And again, obviously there is the issue of particularly sort of students from China. There's no such thing as mental health. It's not obviously recognised in Hong Kong, in China. So it's very difficult for them when they come here to understand obviously the issues that they suffer. What we do is by providing the helpline service and working with the student support service to provide this as an alternative to their own services. So we're not there to replace the service. What we're doing is hoping to be able to provide an alternative service to them so that if they do struggle with any of the students, they can actually give our leaflets out to the students, say, look, you can contact this organisation who obviously can speak to you in your own language. We will try to work with the student support services then. We will encourage the student to talk to the student support services, but there may be times when they may not want to, and then they talk to us confidentially, and we wouldn't share the information unless we have their consent as well. So that's what we do. So it's written, you know, that our helpline is actually sort of shared with sort of the new arrivals with each new term that comes in. And just for a quick information, University of West of England, their one of the directors is actually our steering group, chair of our steering group for our project as well. So they know a lot of the work that we do, you know, within our project. Does that answer your question?
Sounds amazing. Yeah, it does. I just wonder, how do you go about, or how would one go about? I obviously wouldn't have the authority, but I'm a GP there. It sounds really interesting, and I definitely think that'd be something that we would be interested in. How would we go about maybe asking you to, would you speak to a group of GPs, or would you, could we give your details to the wellbeing service or student support services, or how would one go about trying to get involved?
We give our information to the student support services first. You know, they're the teams we work with primarily. We're more than happy to share our helpline details with, you know, people like yourselves directly if you wanted to. And again, you know, there's a service where it's not just the actual student who can contact us, staff and anybody who obviously is concerned about particular students, and if they wanted our input in talking to the student, we'd also be happy to, you know, talk to them in their own language. It is primarily obviously for the service user, but the service user in this case could be the university or organisations like yourself as well.
And just to answer some questions in the chat, sorry, I think the helpline does also cover the University of Bristol as well, doesn't it?
Yes, yeah, it does cover, again, I think, again, we talked about the Student Mental Wellbeing Project, which is, we're just about to start now. We're producing posters, which will be talking directly to, obviously, a lot of the students here in Bristol. It only covers, the funding only covers for the two universities in Bristol, so UWE and University of Bristol. So if you're interested, we'll be happy to work with yourselves, you know, in the university, because it's very difficult to get into University of Bristol. So it's one of the sort of problems we do face working with UOB.
Yeah, I'm not sure if I should answer. There's a question in the chat just saying, are there any particular areas within BNSSG where the Chinese community tend to live? So the Chinese community, I think, we're widely dispersed across Bristol and South Gloucestershire. I think there tend to be slightly less living in North Somerset, but I'd say, yeah, we're pretty evenly dispersed. I would say inner city east is quite a lot of Chinese residents there, and also with the influx of Hong Kong migrants within the past couple of years. So a lot of them have arrived as well, quite a few in South Gloucestershire. So those are some particular areas, I guess, as well. I have noticed there's a lot more Chinese community where I live in North Bristol as well.
Tina, do you want to ask your question now?
Yes. In terms of the well-being activities for the elderly, so say a couple has, you know, she's got dementia and he's not the carer, you know, the kids are taking care of mom. Where do you hold your like well-being activities for them? And is there transport provided for them to get there? Because we're in North Somerset, so it's a little bit difficult to tell a 90-year-old to get a bus to like these activities.
Yes, so our activities, they are mainly held at our centre, which is the Basel Centre. So the person living with dementia, they can bring whoever they want to come along with them, and that person can either join in the activity with them, or they can just sit and talk to other people like carers or other family members as well. So they're very much welcome to join as well. In terms of transport, it's really kind of depends on the workshop. Sometimes unfortunately we don't have the budget always to provide transport, but for certain workshops, like we recently had two, and we did manage to provide transport. So unfortunately it really depends on the workshop and kind of what funding you'd be given.
Okay, cool. Thank you.
Is there...
Emily, I just thought maybe we should highlight the BNO community in particular. I don't know if everyone's aware of the new Hong Kong BNO community that are coming over. Chloe is one of them, and she obviously talked about some of her experiences, you know, coming over here, and obviously the different cultures, etc. But something to be very aware of, and we're gradually sort of getting to know more and more of them. There is this new Hong Kong community who've been coming over since 2021, the start of 2021. And we hear through, I mean, within my team, I've got community development workers, and we've also got our own colleagues like Chloe who are from the BNO community. And there are a lot of problems at the moment with them struggling to register with GPs, struggling to register with dental facilities. Like we said in the presentation, obviously the cultural shock of when you arrive here, you know, the NHS services, although free, is not instantly accessible. So there are a lot of issues with our community, and we do know some of the community are struggling to get treatment here, and therefore they're going back to Hong Kong to go back to get some of their treatment. So it's something, you know, you all need to be aware of. As Emily mentioned there, that a lot of our community who have arrived here in the Bristol area have settled in South Gloucestershire, because most of them look at sort of videos and everything to say where the best schools are, and a lot of them prefer to move into sort of more modern houses. So please be aware that when, you know, if you do get a Hong Kong arrival coming in, you know, they may not understand everything. Obviously, they're English, some of them obviously do have limited English as well. And they may not understand sort of how the whole system works at the moment. So please be aware that, you know, there are difficulties with them arriving here in this country. I mean, their priorities are, you know, they don't get access to universal credit. So as part of obviously being a visa holder, BNO visa holder, they have to be able to find a job here. They can live here. They have access. They paid for access to the NHS services here in the UK. And obviously, we do understand, having worked with people like South Gloss Council and obviously BCC as well, there are difficulties for them at the moment ensuring that they can access some of the services. And when we worked with Bristol last year, doing this NHS 111 service and out of house workshop, there were quite a few of them who joined the workshop, and they sort of, you know, explained firsthand some of the problems that they are encountering. So please be aware, you know, with any surgeries, if you've got part of this new community arriving, be aware it is, you know, it is quite daunting for them as well. Thank you.
Yeah, I just want to say, yeah, we do have leaflets for our services as well. To answer your question, sorry, Tina, that we could probably either send or drop off at your surgery.
Has anyone else got any questions? Okay, well, thank you very much to everyone for coming along to the presentation, and thank you, Emily, and all the team. It's been a really interesting presentation. If that's all right by you, Emily, if I pass on the slides to the people who've requested an interest, is that all right, Emily?
Yeah, that's fine.
Fantastic. So thank you very much for your time. If you've got any questions, you know, just send me an email. So thank you very much for coming.
Thank you. Thank you.
Bye.
Thank you.
Thank you. Thanks a lot. Very helpful. Thank you.